Research review. The effects of mindfulness-based interventions on cognition and mental health in children and adolescents. A meta-analysis of randomized controlled trials. This was printed in the Journal of Child Psychiatry, March 2019. The National Library of Medicine, National Institute of Health. Abstract background. Mindfulness-based interventions, MBIs, are an increasingly popular way of attempting to improve the behavioral, cognitive, and mental health outcomes of children and adolescents, though there is a suggestion that enthusiasm has moved ahead of the evidence base. Most evaluations of NBIs are either uncontrolled or non-randomized trials. This meta-analysis aims to establish the efficacy of NBIs for children and adolescents in studies that have adopted a randomized controls trial design, or RCT. The methods: a systematic literature search of RCTs, randomized controlled trial designs, of MBIs was conducted up to October 2017. 33 independent studies included 3,666 children and adolescents. Were included in random effects meta-analysis with outcome measures categorized into cognitive, behavioral, and emotional factors. Separate random effects meta-analysis were completed for the 17 studies that used an RTC design with an active control condition. Results. Across all RTCs, we found significant positive effects of MBIs relative to controls for the outcome categories of mindfulness, executive functioning, attention, depression, anxiety, stress, negative behaviors, and small effect size, ranging from 0.16 to 0.3. However, when considered only those RTCs with active control groups, significant benefits of an MBI were restricted to the outcomes of mindfulness, depression, and anxiety stress only. Conclusions. This meta-analysis reinforces the efficacy of using MBIs for improving the mental health and well-being of youth as assessed using the gold standard RCT methodology. Future RCT evaluations should incorporate scaled-up definitive trial designs to further evaluate the robustness of MBIs in youth, with an embedded focus on mechanism of action. Introduction. Mindfulness has been defined as intentionally directing attention to present moment experiences, with an attitude of curiosity and acceptance. Individual differences in levels of dispositional mindfulness can be reliably assessed in both adults and children and adolescents, with higher levels associated with better functioning for a range of psychological and physical health outcomes. Mindfulness skills can be augmented through training, and a range of mindfulness-based interventions, MBIs, have been developed to enhance these capacities. It is hypothesized that the enhancement of proximal skills trained by MBIs, such as non-judgmental attentional control, may have downstream effects on more distal outcomes, such as improved behavior or reduced symptoms of psychopathology. Although the origins of mindfulness are rooted in Buddhist philosophy and date back around 2,500 years, the earliest example of a formalized MBI is mindfulness-based stress reduction, MBSR Kabat-Zinn, 1982 and 1990. MBSR was developed to help individuals learn to cope with and manage illness, pain, and stress. Based on the principles of MBSR, other MBIs emerged in the years that followed, such as mindfulness-based cognitive therapy, MBCT, that focuses on helping to prevent the recurrence of depression. In a general, research with adults suggests that MBIs have positive effects on both mental and physical health. Though there were methodological concerns about some past studies in terms of insufficient construct validity of outcome measures used, intervention methodology, and how the data are interpreted. More recently, focus has turned to the benefits of using MBIs with children and adults. There are a number of rationales for introducing mindfulness to young people, including enhancing core cognitive skills to support academic and social functioning. Indeed, childhood and adolescence may be particularly valuable time to practice mindfulness, as self-regulation and executive functioning develop markedly across this period. In addition, adolescence is a vulnerable period for the onset of mental health problems, with around 50% of all mental illness appearing before the age of 14. Since mindfulness training has demonstrated efficacy in preventing depressive relapse in adults, it is appropriate to explore whether MBIs could also prevent depression or improve mental health and well-being in young people. However, enthusiasm for MBIs with children and adolescents has arguably moved ahead of the evidence base. There are careful guidelines about the development and evaluation of complex interventions from the theory through to implementation. Early stage evaluations along this trajectory include case studies and case series, and uncontrolled or non-randomized trials. Although helpful in identifying the likely efficacy of an intervention and in ironing out procedural uncertainties, such early stage studies should be regarded as preparation for randomized controlled trial RCT evaluations, which represent the current gold standard assessment approach for emerging interventions. In the case of NBIs for children and young people, the process to date has rarely moved beyond early stage evaluations. Only about 30% of current studies have randomized participants to condition, and around 50% have used a comparison condition. The choice of comparison condition issue is also an issue. Typically, these are passive, non-active comparisons, such as no intervention, teaching treatment as usual, or wait list, that do not account for non-specific aspect of training that might nonetheless affect performance, such as spending time with a new teacher or increased motivation in doing something different. Currently, only around 10% of students have an active comparison condition. An active control condition in MBI studies should refer to something that might be expected to benefit its participants and that matches the MBI in all non-specific factors. Importantly, it should not include mindfulness as an active ingredient, so that differences between the groups can be attributed to the absence or the presence of mindfulness.